So, tell me about the Facebook post that you sent.
Okay. I gotta basically build the scene for everybody. I was
Yeah.
scrolling through social media in the evening, nothing better to do. And I see this post that came up. We'll just say a local moms group. Laura and I live in the same city, so if you know where that is, then you have now probably deduced the moms group. Where dead
Also, we love our local moms. Like
we
it's
do. And
Ashley's
you know what?
literal population.
And that's who I work with, but
Yeah.
sometimes I'm scared.
Yeah.
This is one of those times.
Mhm.
So, dead ass, somebody posted on this group, um, am I pregnant? With a pregnancy test
Yeah.
with the result. It had populated. She had done the peeing part well.
Yeah.
And guys, I kid you not, the discourse that came in this thread was unbelievable. It was
Scared for
unbelievable.
humanity.
It was scary for humanity. There were some people that were like, nah, girl, you're good. And
I go have wine tonight. Cheers.
wine, cheers, baby. And then some
You
that were
avoided it narrowly.
no, you knocked up. And you know what, guys? It was 50-50. And I just sat here and was like, just blown away. I was
She
just
was
blown away.
pregnant.
She was pregnant.
She was pregnant.
She
Spoiler
was,
alert.
yeah, she was pregnant. And I sent it to Laura right away and was like, oh my God. Oh my
So
God. This is where we're at.
I took the photo because I was crying laughing because okay. There are things that you can just Google. She's like lost the box.
Right. And
Like
decided to go on was I can't remember if this one was anonymous. God, for her sake, I hope it was.
I hope it was. But okay. We speak about being an informed consumer. This is a time where it would be appropriate to look on the internet.
Yeah.
Being an informed consumer.
Or call a friend, call
Call a
your
phone
mom.
call. Call your
Do
mom.
anything besides post on, your local mom group if you're pregnant or not.
So
Holy.
I took that screenshot and I sent it to my mom because I thought it was so funny.
Right.
So
Did she know that it was a positive test?
yes.
Thank
So
God.
I sent it to her. I sent this whole screenshot, but she has an Apple Watch. So when I have a Garmin. I'm obsessed with my Garmin. I love my Garmin. I don't have an Apple. But allegedly, when you send like a text message to an Apple, for me, if Ashley sends me a text, it says image, and then I have to look at my phone and I like open the
Right.
image. Not a big deal. I don't have this watch for my phone. I have it because it's better for exercise and all the things. So my mom, I guess, sees image of a small pregnancy test her
Up again.
on her Apple Watch. So then I call her because I just want to like gossip. I'm like, hello. Like, so I call, she answers the phone. Hello? I was like, what is literally wrong
What
with
is
you?
wrong with you?
She was like, well, what did you didn't you just send me a pregnancy? Yeah, mom, it's not mine. She was like, oh my God. She literally thought I was pregnant.
Do you think she's gonna
Um,
be happy for you? Now we gotta dig deeper into this. Like, was she
oh
like
yeah.
she
She would be,
lost her marbles, or would
oh
you
no,
think she
she'd
was
be
gonna be
happy
so
for me if it was
right?
like 7 kids. She'd be like all in, 100%.
Okay.
Oh yeah. No, she's in. I'm fine. Like let's tell the community. I have a home.
So you need to limit your
Laura has a space for
child
the
planning.
kids.
Laura and her husband, by the way, whom I've met, he's a wonderful gentleman. They're not degenerates. Yeah, no, they're good. They could have more babies if they wish.
You, another child? Oh,
Oh
in
my God.
in this economy?
Well, listen,
Listen,
grocery
in this
prices are
economy.
real.
In
Grocery
this
prices are real.
economy though, for real.
Yeah, for real though.
So, okay, but here's the deal. We had a laugh. We like went through it. It was funny. But then I took a real serious pause. Dr. Laura hat came on, and I just thought,
What is the
wow.
problem?
This is a problem. And so this is why we wanted to talk about it. Not because we want to shame anyone, like, but it's a silly, fun thing. But
But as an adult woman, we should
yeah,
have a good idea how to read a pregnancy test.
yeah, it's
One
a
way or the
big,
other. Either you're trying to get pregnant or you're not. Either way, pretty important information to have.
pretty important information. And here's the deal. There's so many different ones out there, but they all use the same logistics, right?
Right.
There is a control window to make sure the test is not faulty. And then there is a positive. So it might be in the same window where there's a control line, but there's always a control and then a not. And then like the test, right? And it brings me back to when I was newly practicing. I was going to anywhere that would have me speak. I was like, please let me speak. Like, I will come, I will teach you all the things. Like, just let me come in here. So I ended up going to my old high school and speaking to a grade 9 girls' health class, gym class, health class. And I actually did like a talk on hormones.
Mm-hmm.
And we spoke about how a period works and how hormones work and birth control. And when I tell you these grade 9 girls' jaws were on the floor and could not get picked up off the floor, when I told them that, being on birth control, they don't have a real period, and this is how their period works, and this is how to get pregnant and avoid pregnancy. I didn't tell them how to get pregnant. I'm telling how the body works.
Probably a good bet. I think Laura would not be invited back.
No. And so it's just crazy to me that we are not taught any of this in school. And even fast forwarding to picturing myself in post-secondary education, went to high school, went to university, went to my doctorate program. It was not until I was at Canadian College of Naturopathic Medicine where I fully could tell you, I confidently understood how women's hormones worked.
Well, to this day, to be fair, I will often ask women about their cycle length, right? And they'll be like,
2 days,
5
3
days.
days.
5 days. And I'm like, what? And the
Yes.
first couple times I was taken aback, I was like, no.
You get a period every 5 days.
and yeah, everybody was like, well, that's how long my period is. I'm like, okay, let's take her back a bit, right? So I think to a degree, we also take, as much as we're being like kind of jerks laughing about the pregnancy test, we also take this knowledge for granted. And that's why we're here to educate people in this very casual capacity.
Yeah. No, like I said, we're not hating on anyone. We're just it is crazy that the education system doesn't include like what's happening in our own body. We don't learn about how to do our taxes, and we don't learn about how our period works. And it's really, really crazy because I see it.
And I needed to know both of those things. I really needed to know
both of those things. And I've seen it firsthand working at, so for those who don't know, I actually worked at a conventional medical fertility clinic for 2 years. I'm no longer working in that capacity, but I still work with fertility patients. And the craziest thing is I don't know how to word it, but it's almost like when so the way I practice and the way Dr. Ashley practices with patients is a patient comes in, seeks your care and your advice, and you are like, okay, listen, this is what we're going to do. Here's why. Here's why. I want you to understand that here's the connection between this, and here's how we are going to help bridge that connection to make it better and stronger. And here's how long it's going to take, and here's in what capacity I'm going to work, and here's the capacity you're going to work, and here's what we're going to change and what we're going to do. You go into a fertility clinic, hi, here's your meds, see you in a week. Hi, here's your meds, call me in a week. Come get blood work, come get ultrasound. The patients are like whiplashed back and forth between appointments, and it doesn't give them any sense of confidence as to what's
the why, right? Nobody knows the why in this setting.
No, and they don't know why. They don't know what's going on. They can't explain to me when I'm seeing them as a secondary practitioner to, support their care conventionally. I'm trying to understand what's going on. I have to look at their records because they have no idea, and it's not their fault. They haven't been provided any of this information. Now, it does all come back to the healthcare system because fortunately for you and I, we are paid in a way that we have more time with patients. But OHIP covered physicians in our province
Yeah.
do not have the time, and they have
Totally.
a million patients. So it's not their fault either. It's like, where's the answer, right? This is why we've come on in this type of format, because I think people need to understand how their own body works, and that's not being facetious. Like, I think we need to understand how our body works. And it's crazy to me, like when I sat there in this grade 9 classroom delivering this information, I thought to myself, do you want to take a bet as to the percentage of people in here who have had sexual intercourse?
I'm gonna say probably high.
Probably.
I
And
had
they
sex in high school, so I
and
mean,
they
I'm gonna throw that
don't
out.
even know how birth control works. They don't even know how their cycle works. So they
Equals
are going to be
unplanned pregnancies.
right. They are going to be part of the population that, and again, I don't mean the public, they're the entire population of people who get pregnant when they didn't intend to.
Right.
Or the people who go through their adult femalehood with debilitating periods and never seeking help because, well, my mom had debilitating periods, and
I
my
just do.
grandma,
It just is.
it just is. We just take, and they've now missed an endometriosis diagnosis. And instead of getting completely evaluated and diagnosed and put on a plan, they're now not finding out they have endometriosis till they're having fertility issues. Now we've waited a long time.
Population in terms of when a lot of us are emotionally ready, financially ready. Fact of the matter is we're having kids later in life. So, if that time of trying to get pregnant is now in your mid to late 30s, let's say, which is not unheard of,
Yep.
then it's just a more challenging window in which to have all these interventions done. It's not that it's impossible. It's just like, why? Why when we could have done this so much earlier?
Yeah, I know. And there's so much misinformation about periods out there. And when I speak to grown ass individual women who don't know, and they themselves are like, listen, I don't know anything about
Yeah.
this, and it's so embarrassing. I'm like, no, it's who would tell you? Because
Right.
when
How would
I
you just
learned,
know this?
you wouldn't. And like, my mom was a nurse, so I think I knew a little bit more than the average person growing up. But I also didn't know a lot. So
Right.
today I want to talk about let's like circle back to how to properly read a pregnancy test. And then I want to like,
If you lose the box.
if you lose the box, here's what
Right.
we're going to do.
Right.
And I also want to go over a couple myths, and then also like veering right away from pregnancy tests. Like, I heard you had the police at your house. So I definitely don't want to like gloss over that
That had that had
information.
nothing to do with fertility or periods, believe it or not.
It had
Um,
something to do with a pregnancy test. I'm just joking.
yeah, you're right. Circling back to the point.
A neighbor, a
Yeah,
pregnancy
man.
test in the
Holidays,
library with the candlestick.
holidays were interesting in my house. Yeah, I kid you not. I home with my son, and I hear a tap 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 at the door, and I'm a very low tech person, so of course Dr. Laura has this beautiful camera system, and if this happened to her, she could see who it is, but
It
I
would
gotta
be
do the whole
identifying the human.
I gotta hold you the little beat through the shutters. Who dare? And then I noticed that it was a police officer in uniform, and I was like, what? And again, at this point, I'm not worried about it because I'm a very boring
No, no, no.
law-abiding citizen.
Immediately, I'd be like, who died?
Oh, really? I wasn't worried. I was
Yeah.
like, they've got the wrong house, obviously.
You're like, hello,
So,
welcome.
yeah, literally, I open up, I'm like, hey, what's up? And so, anyways, long story short, she was really sweet and probably quite a bit younger than me. And it was like, I got this complaint. This was this Boxing Day? This was like immediately after the holidays. She's like, I got this noise complaint. Do you have a dog perchance? By the way, circling back, I volunteer in my spare time with a local rescue, and I am a foster mom to dogs, right?
Out
So
of
I
the
take
goodness
dogs.
of her heart.
And because I really love puppies.
And
So yeah,
if you've listened to our previous episode, you know that said puppy has diarrhea in her
right.
home. So she
Yes.
really, really likes
I
animals.
really like dogs. So, anyways, we take dogs from primarily northern Ontario, actually, rural, and dogs have been abandoned, dropped off at shelters, poor socialization, and a lot of them are. Some of them are not even used to living with humans. So, my current foster dog, Orla, what a name,
Mhm.
is she was homeless, so she lived with her owners in a small car,
So
and
sad.
it's so sad. It's so sad. So, anyways, she doesn't have a lot of socialization and she's never had a yard to roam around. And I actually have my neighbors on either side have dogs. So when she goes outside, she can kind of like peep them through the fence and she barks and she runs up and down the fence and stuff like that, right? So, anyways, I was like to the officer, I was like, yeah, I have a dog. She's in her crate. Do you want to meet her? And I think she was like kind of taken aback. And she was like, yeah, actually. So I invited her into my house and I said, meet Orla. And I took Orla out of her crate. She was really calm and quiet inside the house. So, she sat down on my couch and was playing with the dog. And I offered her coffee. And she had sort of said, one of my neighbors who I know
Did she
exactly.
drink the
Yeah,
coffee?
sure she did. Sure she did. Why would you do that? I have a great
I
espresso
don't
unit. Yeah,
I,
man.
I don't know. Maybe they have a thing where they think that they're going to be poisoned
Well,
at
like, I'm not
patrons'
going to give
homes.
like the badge number. Maybe it's not protocol or anything. But yeah, she sat down. She
I
sat
won't
down
sell
and
her
had a
out
cup of
here.
tea. Yeah. And anyway, so we were chatting. I said, I volunteer for this organization. A lot of these dogs are actually poorly socialized. And yes, when she is outside, sometimes she'll bark at the dogs on the fence. I don't leave her out there, right?
Yeah.
Again, if you know anything about Ontario and an Ontario winter, I'm not just going to leave the dog in the snow. And she said, yeah, the report is that this was at 11 o'clock in the morning, by the way, 11 o'clock in the morning on the holidays. And they were like, yeah, the report is that the dog is left upwards to 10 and 15 minutes barking outside. And I was like, what?
Okay, but like 10 minutes during the day. Can we clarify though that
Mhm.
this person who called the police station
Yeah.
is not your direct neighbor. So
No,
it's not
like
like it's
two
an
doors down.
indoor
And
thing.
nor did this individual um
Work.
work, so retired, and nor did they take the 5 seconds to walk two doors down, knock on the door, and say, hey, friendly neighbor. I noticed that there's a dog barking out there outside. Like, is there something we can do about this?
Yeah.
So I'm actually a pretty approachable
Or
person.
like I'm just trying to enjoy my tea and crumpets at 11
Right.
a.m.
As I stare grumpily out my backyard at the
Some
nothingness
people
that is the Ontario winter.
like
So it was just kind of like a mind-blowing experience. But anyways, she was lovely. So she was like, she just kind of laughed. She had her espresso and was like, okay, check. I can say that I came. Like, went on her merry
it's
way.
some
Easiest
people
call
are
she had to do all day.
some people are so miserable, honestly.
So miserable.
You could just be
Um,
nice. You could
Yeah,
just
so
be
anyways, there was
nice.
a follow-up story. I wrote a note introducing myself to this gentleman and walked over.
Oh, did he
Uh,
follow up?
no, of course not.
Oh,
Of
okay.
course not. People are like little keyboard warriors or call the cops
Yes.
warriors. Nobody wants
God.
to have a conversation with you, right? So
Yeah.
I just, I wrote a handwritten letter,
Which
introducing
totally does the
myself.
trick.
Totally does the trick, right? I took that time to write out that
Yeah.
page letter, introducing myself and the organization I work for and, where these dogs are coming from. And, I doubt it, but I'm kind of hoping that this individual just has a little bit of compassion moving forward in their life because holy cow, it must be exhausting to live life so miserably.
So miserably. Now while we're on this topic, we might as well take the opportunity to plug the organization that you foster for.
Oh yeah, yeah. So I foster for an organization called Precious Paws, and big in the Simcoe County region, which is where Dr. Laura and I are. And yes, so they take puppers from all over Ontario, but like I said, there seems to be a larger chunk coming from Northern Ontario rural communities. Oh my gosh, there was just like a litter of puppies that was that's in need for foster. And there was a parvo puppy this week. So I don't know if you guys know much about parvo virus, but it is a really challenging virus that some young puppies can get, often in poor conditions, like puppy mills and stuff like that, and breeders that
Oh,
don't know what they're doing. I know, and it's really really tough. A lot of puppies don't make it through it, so they end up being really lethargic, throwing up, diarrhea, and it's a really aggressive virus that often involves around the clock support. So they're often on IVs. They need 24/7 veterinarian or veterinarian technician um, observation, which makes it incredibly expensive to treat. So a lot of people will surrender parvo puppies and say, "Have it. Like, I can't pay for this." And of course, vets are, I just think, the most amazing people. The amount of times that they discount their services and adopt dogs on the spot, where they're just like, okay, I guess this is my dog, I'm going to do the work type thing, or do it for next to nothing for organizations such as this, is just really incredible. So if anybody is considering, wanting to give back to the world, but maybe they're not ready to take on a full-time dog, this is a great way to really help give back. Do some, you're donating your time. So most organizations cover all of the costs, so I don't pay for food, veterinarian visits, obedience training, or anything like that. And you just get to kind of help dogs get to their like forever homes, right?
so cute. I love it.
Yeah.
We will link the organization in the show notes if anybody's
Yeah.
interested in reaching out, because I thought that would be a neat opportunity to
Yeah, I
plug
think it
them.
is too.
So let's get back to pregnancy.
Circling back to health.
Circling back. So today's health topic is kind of a health topic slash ask Reddit, because I found it on Reddit, although the actual initial or the actual post has been deleted as of 6 days ago. So it's no longer there. But the title and the gist are what kind of led me to want this to be the same health topic. Along with the intro of the pregnancy test, I felt like it was a good leeway into what we're going to talk about now. So it says, can you just exist as a woman without surgeries or hormonal interventions? And the gist of this post was just talking about why is it so difficult for women to go about their life and not be on, hormones or anything of that nature, and just, not have to worry about pregnancy and not have to worry about all those types of things. And again, I think this goes back to the lack of education.
Correct.
Now on this post, I found it really interesting that people were saying, well, why don't the partner that you're with just consider a vasectomy, because they're easier, it's an outpatient procedure. And when we talk about can we just exist, we're talking about existing without getting pregnant, just to be clear. Vasectomies are a lot easier. And I feel like a lot of men are super hesitant to get vasectomies, and I don't know if you have thoughts onto why that is. I think there's potentially some misinformation with like a thought of manhood or something of that nature. I don't
Fear of
know.
the procedure itself, right? Like, coming
Potentially.
at that particular body part, right?
Yeah.
Seeing, feeling very overwhelmed, very scared.
Yeah. So, that's always an alternative. But I speak with a lot of women, as you can imagine, day in and day out, about whether it's in person with a patient or someone who messaged me on social media or random comments on TikTok videos that I've made in the past, because I haven't really shown up there recently a ton. But just, I've seen a lot of conversation as to, I don't want to be on birth control, but I don't want to be pregnant. And I think the conversation has always been like, you're either on birth control or you're pregnant. And even in the perimenopausal, group of individuals, they're like, yeah, I'm on an IUD. And I'm like, how old are you? 42. But
Right.
I'm going to keep on it till, whatever, because I don't want to get pregnant. My question is, but can you? First of all, can you
Right.
still? And then the second question is, okay, if you can, there's other ways that we can, not. And the conversation I have always starts with a funny little comment that I make saying, at the end of the day, I am not in the bedroom with you, thankfully, right? Thankfully, I'm not going to be there.
Thankfully.
But
It's a different
also,
business, not
but
ours.
also I'm not going to be there. So at the end of this conversation, you have to decide what makes the most sense for you in your life with your lifestyle. And that's not me coming from a place of judgment. That's me coming from a place of real honesty, because I could speak to someone and say, listen, fertility awareness method is actually super effective. In fact, research shows that it can be as effective as the birth control pill when used effectively. But if you are not doing the method effectively, it's not effective.
Just like if you aren't using other methods of contraceptive effectively,
Right.
like when we look at how many people take the birth control pill, the oral pill, as diligently and as prescribed as they should be.
Yep.
Also, generally not as effective as under that perfect environment with all those controls.
Yep. 100%. And we have to look at a few other things as well. Number one is, I think people think you can get pregnant any day of the month.
Right.
That's simply not true.
Until you're trying to get pregnant, and then you realize very quickly when you want to have a baby that actually it's almost like the stars have to align, really.
Right. And that's the craziest part is, so one thing that I like to educate patients on is that sperm can live up to 5 days. So the average is like 3 to 5 days in the right circumstances. So again, things have to kind of align, but I tell patients, I'm like, listen, if you are having unprotected sex and you are not pulling out, withdrawing, whatever you want to talk about, you are risking that, because
100%.
you can only get pregnant after you've ovulated. But if you have sex 2 days before you ovulate and you do not
And it
withdraw
lives. The sperm
and it
lives.
lives for those 2 days, it's actually an optimal environment for pregnancy, right? And then we have to think about contraceptive failures, and those sorts of things happen all the time, right?
Mhm.
And so those are things to think about on the back end of this conversation, right? But I really like to educate on fertility awareness because it really sheds light on the idea that you can actually exist as a woman and not be on hormones and avoid pregnancy successfully and learn some things about your body that you might not have known before. And I think that in itself is such a valuable tool. Um, I'll give a little bit of my kind of personal history, because this is kind of what's made me so passionate about what I do for a living, because I growing up, rather, I had really, really painful periods, really, really heavy periods, and really bad acne. As you can see, I have a breakout going on, which I'm very acne prone. That's just like my vibe. Something
Right.
goes wrong, Laura gets acne. Like, that's just how it goes. So growing up, I went on birth control for acne at the age of 13. I was on it till the age of almost 23, 22, 23. At which point, or maybe I was a little younger, maybe I was 21, 22, either way, at which point I went on the copper IUD. I went off of birth control initially because I was just tired of it. I was like, I don't like how I feel, and I'm just over it. And I remember I was in university, second year, and I threw it in the garbage. And then I was like, oops, now what? So then after that, after I threw it out, I ended up going on the NuvaRing, another hormonal birth control, because my doctor convinced me, because I was like, I don't know what to do now. So for those who don't know, it's like a little flexible silicone ring that you actually insert into your vagina for 3 weeks out of the month. Then you take it out for 1 month, where you have that with, or 1 month, 1 week, and then you have a withdrawal bleed. You do it again. That's how it works. I was having consistent yeast infections, consistent, to the point where
It's not cute. It's not fun.
no, and I should have bought stocks in Caneston. Like, that's what it was. I had
So unfortunate.
prescription after prescription. So I was about to go into Canadian College of Naturopathic Medicine. I was about to become a naturopathic doctor. So I was at university finishing up my 4th year. It was summertime. Went to my doctor and I said, "Do you think it's the birth control?" She said, "Absolutely not." I said, "Okay." So now I went
No
home.
questions asked.
I did everything to get rid of these yeast infections. I was like reading bottles, avoiding vinegar. I was like, no vinegar, no sugar, no bread, no. I was like, I can't eat ketchup
You
on
must have been a
what
really pleasant person cutting
it
all
was.
these things out.
It was really great. So fast forward, I, get to the Canadian College of Naturopathic Medicine, and typically similar to your CMCC, we see an intern to treat us. So I saw an intern, naturopathic doctor in training, sat down with her. I'm like, chronic yeast infections. She's like, I think it's your birth control. I said, nope. Doctor said it wasn't.
nope.
Doctor said nope, period. She said, maybe we should just take it out. I said, deal. Took it out. When I tell you, I have not had one. You know how many years it's been? I don't know. Let's say I was 22. Let's say I was 22. I am 33.
Crazy.
Not had one. Now I'll touch wood. I'm going to get a yeast infection tomorrow.
Imagine what you went through, because I had one yeast infection when I was very, very ill. Like I was very immune compromised at that time, and I ended up with a yeast infection. I was like, what in the sweet hell is this?
Mm-hmm.
Like, I don't want this. I can't imagine having to deal with that.
Yeah.
Chronically.
So, haven't had a yeast infection since. However, coming off of birth control gave me a whirlwind of problems. Sure. Cystic acne, 70-day cycles, like really, really bad, crazy, crazy times, bad news. I thought I'm never going to be able to have children. Like it was not good. I had fibroids diagnosed. It was like bleeding, a ton. I was on the copper IUD for 2 years and regretted that, took it out. I felt I was in chronic pain. I was like, I don't want to do this anymore. So came off and started my fertility awareness life, which I have done ever since. So fertility awareness essentially is just measuring different factors in your body to really look at, are you ovulating? If so, when? And understanding not only your fertility. Like I have patients track their ovulation who are, we think, perimenopausal.
Yeah, fair.
Right? Like it's not for fertility purposes. It's just called fertility awareness. Okay. So if you look online, you'll see a bunch of different things, and there's reasons why it doesn't work in certain cases. And so what I've done is I've narrowed it down to 3 things I tell my patients to do. Thing 1 for fertility awareness is, potentially there's 4. Let me just get through them.
Okay, we'll count it all at the end.
Okay, number 1, thing 1. Okay, so math. 1, 2.
Doctor, we swear.
Don't come to me with a math question.
No, never, ever.
Okay. Thing 1. Thing 1 is actually just tracking your period. So that's why I don't know, because I don't know if I included it in my numbers. Okay, so that's just tracking your period. Now you're just putting in a calendar or a watch or whatever, day 1 that your period starts. I would prefer you do it in some sort of electronic device, because you'd be surprised when you just put it in a paper calendar. I mean, this is very obvious, but like some months have 30 days, some months have 31. It often seems like periods are coming regularly when they actually might not be coming as regularly type thing. So it's just easier if we have like an exact amount of numbers. So track your period. When does it start? That's number 1. Number 2 is LH strips. So ovulation test strips. You can buy them on Amazon. You can buy them wherever you like. If you buy them at Shoppers or Walmart, they're going to be more expensive. Mm-hmm. Now, coming back to us giggling about someone not being able to read a pregnancy test, not being able to read an ovulation test, that's not as giggly, because it is very hard.
Trickier. Yeah.
Very hard to read it. Now, this is why I usually recommend patients have an app or something they can use to actually read it for them.
Having done this myself, there's 0% chance that I would have accurately been able to like line up the strips.
No.
As they are. Like, I don't know exactly how the phone scans it and puts it into the app, but it does, and it's beautiful.
Yeah, so I always recommend get one that has an app if you have like bare bones strips. But essentially what you're doing is, after you're done bleeding, you are peeing on the strip, usually in the evening. I actually usually tell patients I don't care what time of day, but in the evening potentially could be more accurate. So do it in the evening, pee on it, and then you're going to put it in the same lighting and take a picture of it with your phone every single day. Now what you're going to see is, unlike a pregnancy test, now to circle back, pregnancy test has control window, which should be positive. Right? Should be a line in the control. The other line is either going to be there or it's not, right? If it's there, you're pregnant. If it's not, you're not, right? So typically 2 lines equals pregnant, 1 line equals not, right? with the LH strip, you're always going to see two lines. There's a control line and the LH line. But the thing is LH is always going to be there. It's a matter of how much.
Right.
So you might start to see it get darker and darker and darker as you're getting close to ovulation, right? So that's the difference. So what you have to do is you literally have to line them up. Like, I have so much experience with luteinizing hormone, but if someone messages me their strip, I'm like, I don't know what this is doing. Right? Like, I don't know if that's darker or there's one. I always tell patients, when you use the app, just go by. Does it say low? Does it say high? Does it say peak? Don't go by the number. Does it say low, high, or peak? And you're going to follow that. You do that every single day till you hit a peak. I always say we're looking for a hill. You're looking for low, high, and then you're coming back down. Now, some people have variations of that. That's why I say we're looking for a hill. Okay? So we're going low to high to low. And then we stop. Now you know, okay, this month it was a peak at day 12. So next month, instead of starting right after I'm done bleeding, which to recap, day 1 is when you bleed. Day 1 is when you bleed again. So if you're bleeding till day 5, you might start testing at day 6, right? If you just started testing at day 6, month 1, and you got a positive day 12, you might not start testing until day 10, month 2, right? We're just trying to narrow that window. I just don't want you to miss a day 8 ovulation or a day 18 ovulation, right? So let's just say, and when we go by some patients are like, well, I just use my app and my phone. What your app is doing is using math, something that I'm not very good at. But what we're doing is we're saying your cycle is 28 days. So what we're going to do is we're going to make a line in the middle at day 14, tack on a couple days on one side, tack on a couple days on the other side. There's your fertile window, but maybe you're a day 8 ovulator. Maybe you didn't ovulate at all. That's not giving you the information you need. So LH is going to give you a more accurate window. Now, after that LH is a peak, you're going to ovulate within 12 to 24 hours. That's something to really understand. Ovulation happens within 12 to 24 hours. Okay?
Right.
And then those are the two main things, really. So it is 3. Cervical mucus is something else I have patients track. If your cervical mucus, so your discharge, essentially, we're looking for it to be that like raw egg white consistency. Now there are stipulations. Do I want it there all the time? Absolutely not. It's supposed to be there right leading up until ovulation. If it is there for like 5 days or more, not there at all, or it's there for 2 days, leaves for 2 days, there again, those are problems, right? Things to note, things to track. So those are the 3 main things I have patients do. A fourth, so I wasn't wrong, fourth optional is doing your temperature. Now, it's also known as basal body temperature. I don't talk much to my patients about it because compliance is very low.
Right.
So I just feel like it's not worth it. If somebody's interested, if they've seen like a device on social media.
Versus like when you're going to the bathroom, like y'all have to wipe, right? So you might as well just take note of what's
allegedly
happening down there. Allegedly. I'm not judging if you don't, but I'm just saying.
The other thing I want to note is that a lot of times people, if they're not used to looking at their discharge or their poop, some people are just like get in, get out, culturally, education, like, who knows what your mom did. If your mom was really modest with it, maybe you didn't learn much, right? Like there's a lot going on there. Sometimes I'll have a really common conversation I have with patients is that they're not sure if their discharge was actually in their poop. Because when you have a poop.
Okay, well, fair. As a woman, it's, okay.
So if you have a poop and you bear down and then you look after and it was kind of like slidey when you were wiping, then you look in the toilet and you're like, oh, there's mucus. I always tell patients, clean up, flush your toilet, wash your hands, and then actually insert your finger in your vagina, not in your butt.
Well, I mean, they could do that too. Just
you
make sure
do that too.
In a very specific order.
It just won't give us the data we're looking for right now. So you can do that after.
One of those things. We're not going to be in your bedroom. We're not judging what you do in your spare time. But
you do you
for fertility reasons.
When we're tracking this, we want to insert your finger into the vaginal canal and just see if that cervical mucus is like what we were thinking. Can you string it between 2 fingers type thing? Right. Because if so, it was from your vagina. Your cervix.
Right.
If no, then it was probably in your stool, and we should talk about that in a different
something else. Yeah.
Yeah. So that's the main thing. And if anybody has specific questions about the temperature, we can totally talk about it. Like I said, compliance is super low. There's a lot of factors with it. So I usually tell patients tracking cycle, LH strips, cervical mucus, see where that gets you, and then we kind of go from there. And that'll allow you to see like, oh, a lot of my patients have realized like, oh, I'm actually not ovulating. So Problem one.
Right.
Um,
We find, not to put you on the spot, and if you don't know the
mhm,
exact stats, that's okay. But
mhm,
in terms of effectiveness, let's flip the bill and not necessarily talk about fertility, somebody who's trying to get pregnant, but let's use this and say, I think what we're trying to say here is there's other methods of not getting pregnant, right? Potentially alternatives to oral birth control. Now, do you happen to know the numbers offhand in terms of effectiveness when used ideally,
mhm.
the fertility awareness method, just so that people have like a general idea?
Yeah, so the awareness method, according to Planned Parenthood, is about 77 to 98%
That
effective.
is a very big variation.
Yeah, so when I looked at the data a while back, there was an article that did cite it as closer to 98
Okay.
when used properly. And I think the problem
Right.
is there is methods called, I don't even know what the different methods are called, but there's the calendar method, which is basically like marking in your calendar and I guess hoping
We
for the
just talked
best.
about why that perfect day 14 situation is not
Right.
actually measuring anything really.
And from a just like as a side note, because there's a difference between so a lot of people will track their cycle because they're looking for hormonal imbalances, right? A woman in their 30s has heavier periods, is getting acne, is moody, feeling like they have PMS. They want to start tracking their cycle using the fertility awareness to say, oh, do I have a late ovulation? Because the ideal would be around day 14. Am I ovulating late or am I ovulating
Right.
early? Is that part of this? Am I not making any progesterone? There's a difference between that and the person who wants to get pregnant because at the
Right. A
end of the
general
day,
benchmark versus needing to know when ovulation is to make a baby, right?
well, yes, and I say to patients like because patients will see me for hormonal imbalances, like someone will see me and be like, "I have a day 18 ovulation, SOS," and I'm like, "Yep, I'll help you for sure."
Right.
Other person comes and says, "I have a day 18 ovulation, I want to get pregnant." I'm like, "Try to get pregnant," because I'll tell you for free, you can get pregnant and have a healthy baby on a day 18 ovulation, right? That doesn't necessarily mean that you can't get pregnant and have a healthy baby if you have a late ovulation. But what you can't do is get pregnant on day 12 or 14 with the day 18 ovulation.
Right.
So this is a gathered data. So we're gathering it in two separate contexts, right? In the context, somebody sees me and they're like, "Listen, I got so much PMS, my periods are heavy." I'm like, "Let's fix it." The goal would be to move that ovulation a little bit earlier so that we could normalize that progesterone. But in the pregnancy or in the fertility case, we actually might not need to do anything if
Right.
everything else is aligned. I got pregnant at day 18 ovulation,
Fair.
right? Like it is what it is. So
Possible.
yeah. Okay. Let's move on. Let's talk about pelvic floor therapy. This is more of Dr. Ashley's realm. So I'm going to read this Ask Reddit and then I'll give you the floor.
Hey, love it.
Pelvic floor therapy. Is it actually worth it or do YouTube videos for pelvic floor exercises suffice?
That's a very interesting question and a very vague question, right? I'm trying to think of like a comparison. Um, Nothing's really coming to mind, but it's like it's just so vague. It's just so vague.
Yeah.
So, um at the end of the day, like there's so many different things that people in this arena treat, right?
Yep.
So pelvic floor muscle dysfunction, and its associated things exist on this like wide spectrum, right? So it's like we're talking about one thing when in actuality we're talking about a constellation of problems and symptoms, right? So it's just so non-specific that it's really difficult to answer that. In that, but in general, I think you guys have probably gathered my standpoint in all of this, in that, like, no, we can't just
Mhm.
go on YouTube or on the internet and just do the exercises.
Well,
So
can I just interject and say when I
yeah,
sought out pelvic floor therapy, it was because I was literally peeing my pants when I exercised. And
I would
so,
say that's a common reason for people to seek care.
but I would never be like, I think I'm just going to YouTube it.
Right. Lots of people do. And I'm gonna try to, in order to answer this question accurately, I think I'm gonna draw some examples as to where this would not be a good idea. And I think that will help answer my question. But in general, I'm gonna start this by saying that nothing replaces your primary care provider. Again, these individuals, whether it be a pelvic floor physio, a trained physician, a trained chiropractor that's done a lot of, pelvic floor courses and things like that. They are, and we've talked about this in other episodes, where we're really important is to rule in, rule out different conditions. So be able to provide an accurate diagnosis as to what's explaining this constellation of symptoms and to rule out other things that can cause it, right? That's a really important characteristic of what we do. So I'm going to use an example to kind of answer this. So what I see all the time, okay, this is a profile, this is a type, this is what I do all day long, okay? What I see is a lot of postpartum women and women that seek my services because they're like, I saw you on Instagram, or I was, referred by an OB in town or whatever. I've just had a baby and I want to get back to exercise and I want to do it safely. Like, awesome. That's great. I'm here for this. I'm gonna give like a profile type and why this matters. So typically the women I work with are overachieving. They're really highly educated individuals, high stress. They have a lot of stress generally going on postpartum. Just trying to navigate all of the things. They're trying to do it all, right? They're trying to be a good mom. They're trying to be present with their partner. Maybe they're trying to get a little bit of work done on the side while they're off on mat leave, right?
Mhm.
And they know they're generally pretty well educated women too, so they know the value of exercise, and they want to get back to it. But in general, these individuals, so they're seeing online, right? They're informed. They're like, oh yes, okay, I'm gonna do kegels. I'm gonna do kegels, and that's gonna fix my incontinence. When in actuality, there's a large percentage of these individuals that actually have a lot of tone in this group of muscles that is their pelvic floor. Okay. And their sympathetic nervous system is in overdrive, and their body feels like they're running from a bear, and their body does not know that it's 2024 and there's no bear chasing them, right? But their body holds tone like it is in that fight or flight response, right? So in this specific population, which is what I treat all the time, basically going to these YouTube exercises and doing these different pelvic floor contractions can actually worsen their, let's say, stress urinary incontinence. So let's say they're getting incontinence when they laugh, sneeze, cough, jump, or participating in exercise. It is very likely that these individuals will get worse by these exercises that they have found in YouTube. And instead, what I will generally start with are activities, and positions and stretches that aim to downregulate the nervous system, kind of stretch and bring awareness to the area, getting them to know, like, are they in a contract or relaxed state before we start to load these tissues? Because you have no awareness, right? Same thing as, I like to use the example of mechanical neck pain, right? It's really hard to strengthen a neck and even give stretches sometimes when people aren't aware if they're in a contract and relaxed state. Like, I see people all the time that are like, I'm totally relaxed. I have no, and if anybody's not watching this, I'm wearing my shoulders as earrings. Like, I'm totally chill. I'm totally relaxed. Everything's fine. And I'll kind of be like, okay, can you drop your shoulders though, bro? And then they're like, oh, I guess I
Yeah.
wasn't. So they did not have the body awareness to know if that group of muscles was contract or relaxed, right? So
Yep.
sometimes it's breaking it down to basics and knowing what is the root cause of this and what's the most appropriate way to treat it, right?
Mhm.
And again, if you didn't know anything about how the nervous system behaves and how muscles respond in accordance to the nervous system, then you would just do these contractions and probably not get anywhere, right?
Yep. And then you might say pelvic floor therapy doesn't work.
Doesn't work for me, right? I tried it and it doesn't work. And potentially either the individual you're working with or you yourself on your, YouTube education may have missed the mark, right? And maybe that's where getting a second opinion and or getting the hell off of YouTube would be a really useful thing to do.
Unless you're watching us there, then stay on
Yeah.
YouTube.
Yeah. If you see us on YouTube, you can take that to the bank.
And can you just to end us off and in summary, give us a, I guess, overview of how you as a chiropractor can help with pelvic floor? Because some people might not understand that.
So like a lot of people are like they get referred to me because somebody else they know has worked with me and they're like, I don't really know why I'm at the chiro's office. And fair enough, right? It's less common for the me's of the world to specialize in this, but I treat it kind of like any other condition, right? That's musculoskeletal based, meaning stemming from muscles, joints, nerves, things like that, ligaments. In that, what it looks like working with me is really, really important component of any kind of healthcare provider is going through a thorough patient history. So that's where we sit down and we have a conversation about what your issues are. Like, do you have pain? Do you have functional issues? Like Dr. Laura had said, she's peeing herself working out, right? That would be a discussion. We would talk about if an individual had that awareness, what seems to aggravate your condition? Like, is there specific situations in which this is always happening to you? Have you noticed positions or strategies of relief, right? Are there things you can do? You're like, weird, if I actually do a little bit of a contraction when I go to jump on the trampoline, that helps, right? Or if I do this stretch before I go jump on the trampoline, it seems to be less likely that I'm going to pee myself, right?
Mhm.
Then we go through, a focused health history, right? Because people don't really connect the dots, but it's my job to connect the dots, right? So if you have other pre-existing health conditions that may make this more probable. So for example, we know that if you have babies really close together, so that birth spacing just didn't happen for one reason or another, or you had a really large baby, or you had to have an instrument assisted birth, meaning somebody, your OB had to use forceps or a vacuum to get that baby out of you safely and effectively, that those are factors that cause additional trauma through the pelvic floor. So, as we dig through these things in the history, right, it gives us kind of an idea of the whole picture and susceptibility and the trauma that was had in those regions. Now, in Ontario and in Canada, actually, it is not within the scope of our practice as chiropractors to do an internal exam vaginally. So that's where my scope kind of ends that way in terms of a physical exam. But I wish I had my pelvis here to show you guys. But what a lot of clinicians and patients don't appreciate is the connections from, like, anatomically speaking, from the low back, the pelvis, and the hips, and the relationship to the pelvic floor. So oftentimes from the history and examining regions around, I get a very good idea of what's happening. So if somebody is super tight, having a lot of mechanical lower back pain, may have been diagnosed with a condition called diastasis recti, which is a superficial widening of your abdominal wall muscles, and really tight hips. That's a constellation of symptoms that often exists with pelvic floor muscle dysfunction, right? And you're telling me, you're having painful intercourse, having a hard time inserting a tampon, things of that nature, and you're peeing yourself while exercising. Well, all in all, that gives me a very clear picture of what we're dealing with. And also, I work closely with a team of individuals that all have slightly different scopes of practice and area of expertise as me. So I'm very lucky in that I work in a clinic, but also in a larger community of very collaborative humans, some of which are pelvic floor physios. So oftentimes I will refer and say, this is what I think is going on based of X, Y, Z. If you and the patient think it's warranted, maybe we'll do an internal exam to confirm that. But oftentimes people don't really want to start there, right? So I will move forward in like an exercise and education based capacity, and keep that in the back of my mind, or in the back of our minds, right? That we may move to an internal exam if we're not seeing the results in the timeline in which we expect to see them.
Cool. Love it.
Yeah.
Any closing arguments?
Closing arguments. I want to say, if you hear a dog barking in the backyard at 11 a.m., Don't call the cops,
Don't
man.
have the police be your
Don't
first
bring
phone
the
call.
police involved. And if you
Yeah.
do, offer them a cup of coffee
They're
because that
busy.
seemed, yeah,
They're busy. They don't
they're
need to
busy
come.
people. They're busy dealing with emergencies and actual criminals, not those volunteering with foster organizations.
Awesome. Okay. On that note, thanks for listening, and we'll see you guys next
All right,
time.
chat soon.